So good morning or good afternoon, everybody, and welcome to the webinar, Voices from the Pandemic, the COVID-19 Experiences from Asia. So this event is brought to you by the Global Health Network and its two knowledge hubs, Connect, which is a hub for health workers and field workers, and MESH, the Community Engagement Network. I'm Dr. Mary Chambers, Head of Public and Community Engagement at the Oxford University Clinical Research Unit and Wellcome Trust Major Overseas Unit in Vietnam. So I'm delighted to be joined today by four fantastic speakers. Firstly, Ms. Hoang Nguyen, who's the Media and Communications Coordinator in the Public Engagement Department at the Oxford University Clinical Research Unit in Vietnam. Dr. Gillian Black, Co-Director at Sustainable Livelihoods Foundation, South Africa. Mr. Dinesh Deokota, the Director for Media for Development, Nepal, and Professor Guy Thwaites, Director of the Oxford University Clinical Research Unit and Wellcome Trust Major Overseas Program in Vietnam, and Professor of Infectious Diseases, University of Oxford, and of course, the Global Health Network team. So in this extended webinar, we'll introduce participatory methods of engagement, and in particular, the digital diaries and short films and photographs that were created by healthcare workers and community members in Nepal, Indonesia, and Vietnam as they reflected on their experience through the COVID-19 pandemic. And I'm delighted that one of our participant filmmakers from Nepal is going to join the webinar today. So welcome, Sunita, if you're on the call already. And thank you for joining us. And I hope at the end, when we're in the discussion, that you could give us some reflections on your participation in the project. So in the first session, Ian and I will introduce about the SPEAR project and the virtual exhibition that showcases the deeply personal stories that were developed by members of the communities that we were working with. Dr. Jill Black is an experienced engagement practitioner and an academic from South Africa. She will share her insights on the use of participatory methods to effectively engage with communities. Dinesh Deokota is a filmmaker who led the Digital Diaries project in Nepal. He speaks about his own experiences of the practicalities and challenges of engaging with communities during periods of lockdown and restrictions. We'll then take some time for questions to the panel, and I hope we'll have a very interesting discussion. And then to wrap up the session, our final speaker, Professor Guy Thwaites, the director of a large global health research unit, will reflect on how community engagement can be integrated into a research program. So this webinar session will last 1.5 hours. We will have plenty of time for questions and a panel discussion during the event. So I'd like to now move to the first presentation and introduce my colleague, Miss Hoang. So Hoang Nguyen. Until about 10 days ago, Hoang was the Media and Communications Coordinator at the Public Engagement Department at OCRU, the Oxford University Clinical Research Unit in Vietnam. But Hoang has just arrived in the UK, having been awarded a Chevening Scholarship to study for a master's in media, campaigning and social change at the University of Westminster. Her vision is to apply her creative skills to bettering her community by designing promotional media and finding ways of positively influencing marginalized communities. While working in Vietnam, Hoang has used her media and design skills to develop patient-focused projects and help design more accessible health communication material. She spearheaded public media projects during the COVID-19 pandemic, which were influential in supporting national public health movements. She led the Digital Diaries project in Vietnam and also curated the development of the virtual exhibition, Voices from the Pandemic, that we'll showcase to you today. So I'll start this session with some background to the COVID-19 Digital Diaries project, and then I'll hand over to Hoang to give you an introduction to the virtual exhibition. Thank you. So the Digital Diaries project that we're going to talk about today was embedded in a bigger project called the SPEAR project, which was social sciences and public engagement action research in Indonesia, Nepal, and Vietnam. And the objectives of this research study were to explore the impact of COVID-19 on healthcare workers and on vulnerable communities in those three countries. And this ran for 18 months from June 2020. And then in the second phase, we explored the barriers. In particular, we explored the barriers to access and uptake of vaccines and hope to inform national vaccine strategies. And this has just ended, the data collection's just ended for this second phase. So the SPEAR team consisted of 49 members from these three countries, and the entire project was conducted by Zoom meetings. So many of these colleagues I've never actually met. So this is just a summary of the sites and the research study. There were 12 sites in Nepal, Vietnam, Indonesia, including rural sites and big urban sites. The research methods included surveys, interviews, focus groups, discussions, and the engagement included media monitoring and digital diaries. Next slide. So the SPEAR digital diaries was embedded within this wider research project, and the purpose was to inform the research, and the research informed the digital diaries. So we had 59 participants from the three countries. The participants created videos. They took photos which they then created into posters, or they made Instagram posts. Some of them worked individually, some of them worked with family members or in groups. Next slide. So after the digital diaries were completed, we've taken them back to the communities for screenings. The first of these was the Kathmandu International Mountain Film Festival, where we showed 5 of the Nepalese films, and 2 of the participants were at that event and able to give their reflections on taking part in the project. And then we've also had screenings online and in person. So that's just a bit of the background to the wider project. And from here, I'm going to hand over to Ian, who will take you around the virtual exhibition.
Yeah, thank you very much, Mary, for the introduction, and good morning and good afternoon, everyone from everywhere in the world. I'm Ying again. Now I will briefly show you around the Voices from the Pandemic virtual exhibition. Just give me a second, I will show you the screen of the virtual exhibition on the screen for everyone. So now, as you can see, we are in the lobby where you can find the introductions to the Digital Diaries project, Voice from the Pandemic, to the COVID-19 SPEAR project, and the acknowledgement of the participant and our funders. So in this exhibition, we have total 30 videos and 27 posters showcased in this exhibition. These stories have been grouped in 3 exhibition rooms under the 3 themes of community challenges, healthcare worker challenges, and resilience. And in each room, you will find short films and posters that reflect the personal experience of the storytellers. So for example, you in the community challenges room right over here, you can find a range of personal story about the challenges that the community in Vietnam, Nepal, and Indonesia experienced through the pandemic. They are the story of ill health and fear, and the lack of access to healthcare worker and food, and other also experience the mental health impact and discrimination, or of grief from losing the relative due to the pandemic as well. And then in the healthcare worker challenges theme room over here, you can find a range of personal of healthcare workers who sacrifice seeing their own families for weeks or even for months at a time to safely care for their own patient. Or the healthcare worker also face huge challenges to continue caring for the patient with other existing diseases within the strict health protocol to limit the spread of the virus at the time. These stories have moments of fear, exhaustion, and the loneliness. But actually, I hope when we're watching this film of the theme challenge, we can notice that even in those dark times, there were many moments of kindness and care commitment, also resilience. And speaking of resilience, the last theme we have here is the resilient theme. Even though yet the COVID-19 pandemic has been very dark at the times, but it's also been a very backdrop for a miracle of stories for courage and kindness. And you can find this story in this in the resilient theme room, and this story I believe that represent the best of us. So now I will take you through the exhibition to show you how to use the platform, and but also you can find the instruction on the site when you visit the exhibition. As you enter the virtual exhibition, you actually can choose. Sorry for the very quick move just now, but you can choose. You can either choose to visit the exhibition as a tour, or you can click on the option of to see the exhibition on your own. But let me take you to to one of the theme room from the lobby to explore together. So from a lobby here, as I introduced earlier, we have the 3 theme room. For example, I will go to one of the theme room, community challenges theme room, through clicking on the portal right here. It will bring you to the theme room, and from this theme, in this room, you can see poster and videos displayed on the wall that related to the theme of the room. And to move around the room, you can click on the floor, or you can choose to click directly on the video to the direction that you want. For example, I like to see the video over here, a story of one of our participants. Then I will just click it to here, and it will bring me straight to the screen. And from here, you can see it could be a poster or video. But if you want to see the short description of this exhibit, on the right side of the screen, there's a exclamation mark that you can click on. So there will be a brief description right here for you to view as well. Just give me a second. Yeah, I'm gonna move back a little bit. And at the end of your tour, if you have some thought or any question or any message that you want to send to our participant in this film, please do write these to onto the postal station at the end of the in the banner right here. So these message that we will plan to send directly to our storyteller to receive it at the end of our event. So now this is just a brief introduction to our platform, but now I would like to show you a brief screening story that like to give you an idea of what this story is about.
मलाई अब भन्नुपर्दा अब हेल्प गर्ने लु तँलाई यस्तो गर्छु तँ यस्तो खा तँलाई यति खर्च यस्तो गर्ने भन्ने कोही छैन एउटा भाइले हेर्छ भाइ पनि गाउँमा गएर लकडाउनमा गएर पसेपछि मलाई यो 3 महिना एकदम 3 वर्ष बिते जस्तो भयो यस्तो लकडाउन भने के हो नि थाहा पनि थिएन एक्कासी यस्तो भयो यस्तो भइसक्यो यस्तो भएपछि यस्तो गरेर अब तपाईलाई गाह्रो भएर म ढल्यो भने कोही मान्छेले सोध्दा नि नसोध्ने बोलाउँदा नि नबोलाउने तपाईँ अब यस्तो मान्छे महामारी मर्न लागेको छ महामारीको बेलामा कहाँ छन् भन्ने अनि टाढा जाने अनि त्यहाँ अब आफै तङ्ग्रे आफै बिस्तार तारा कुरा टेकेर पनि म घर आएको छु
Dịch Covid-19 xuất hiện. Với vai trò là một trong những bệnh viện tuyến đầu chống dịch của cả nước, các bạn điều dưỡng của bệnh viện nhiệt đới đã phải cố gắng và trải qua nhiều khó khăn để hoàn thành tốt công tác chống dịch đã được nhà nước giao phó. Mỗi ngày, các bạn phải mặc bộ đồ phòng hộ chống dịch, nón, khẩu trang, găng tay để vào tiếp xúc với bệnh nhân. Thời tiết thì bất kể mưa nắng, lạnh nóng, các chị vẫn phải mặc đúng quy trình tiến vào khu cách ly, đo sinh hiệu, phết mũi họng, lấy máu xét nghiệm, truyền dịch thuốc cho bệnh nhân và chăm sóc chuyên môn khác cho nghiệp vụ điều dưỡng. Những công tác hàng ngày đó cho nên không dễ dàng chút nào vì trở ngại của sự cồng kềnh trang phục chống dịch, vì cái nóng cộng hưởng của thời tiết, vì cặp kính dày che nắng dịch tiết bắn vào mắt và những hơi thở ngột ngạt của lớp khẩu trang dày. Cứ mỗi lần chăm sóc bệnh nhân, cởi bỏ bộ đồ bảo hộ, các bạn lúc nào cũng như tắm bởi mồ hôi rũ rượi khắp mình. Ấy vậy mà các bạn điều dưỡng vẫn tươi cười và hoàn thành tốt công việc của mình mỗi ngày như thế.
Yeah, so that is just an example of our story, one of our stories, and there are more touching story in our exhibition. I hope that you can take your time to tour these images and videos where you will see our mothers and fathers, healthcare workers, and those unemployed, and teachers, siblings, volunteer, and professionals. You can also see people living in urban city, in rural towns, in the remote regions of Asia. And you will meet people who travel through the pandemic in the deep poverty and extreme isolation. And you will hear stories of care, of strong communities, and of generosity. So I hope this story will help you also reflect on your own pandemic journey. So that is the end of my section. I thank you very much, and I will hand it back over to Mary now.
Thank you very much, Ian. Just in case you haven't seen it, everybody, the link to that exhibition is in the chat, and we hope you can take some time afterwards to visit that exhibition and see the stories for yourselves. So I'm now going to introduce our next speaker, who will give us her reflections on the use of participatory visual methods in community engagement. Dr. Jill Black is a researcher and community engagement practitioner and the co-director of the Sustainable Livelihoods Foundation in South Africa. And through her work, Jill engages with people living in marginalized settings about the public health challenges and medical research activities that most affect their lives. She's gained extensive experience in a range of participatory visual methods and has written multiple publications on the ethics of working with visual methodologies. So I'm very happy to hand over to Jill now to reflect on the benefits and challenges of these methods. Thank you, Jill.
Thanks very much, Mary, and thanks, Ian. Just want to start out by saying just what a fantastic project the SPEAR project has been, so illuminating, and the incredibly effective use of the exhibition, the online exhibition. It's such an effective way to showcase the work, and I'm really looking forward to engaging a bit more with it, and a lot of fun to move around the room as well. Definitely going to be looking into doing something like that in the future as well with our work. So thank you for that. And as we've very clearly seen through the previous presentation, a central approach in the COVID Diaries project, in the SPEAR project, was the use of participatory visual methods. And it's the use of visual methods for engagement and research that I'm going to be talking about today. So not so much about COVID-19, but about the use of those methods. And I'm particularly going to be reflecting on some of the challenges as well as some of the impacts, and very much drawing on my own experience in that regard. So the two main goals of our work with participatory visual methods at the Sustainable Livelihoods Foundation, and I'm going to refer to us as SLF from now on, are community engagement in public health and health science and participatory action research. So in using visual methods, we've acted both as connectors between community members and researchers, and we've also acted as researchers ourselves. And very broadly speaking, the overall purpose of our work at SLF is community development, and all the visual methods processes that I have facilitated whilst at SLF over the past 10 years have been undertaken in the context of townships and informal settlements. And this slide shows a photograph of Overcome Heights in Cape Town. And this is one of the informal settlements where SLF is currently working. Now, people who live in and work in highly marginalised and economically disadvantaged settings, like Overcome Heights, for example, tend to be at the highest risk of health challenges, and the health challenges that health research sets out to address. And these settings are often also characterised by limited educational opportunities, and linked to these limitations, relatively low levels of literacy. And in taking a visual methods approach, it can enable people who live in these types of circumstances to share their perspectives on topics of research and research activities, and the knowledge that surface can be used to inform research priorities and research design. So in this way, visual methods can help to foster inclusion in research. Some of the visual methods that we've used at SLF that we've worked with include digital storytelling, theatre. We've also used photo voice, collective filmmaking, and various different kinds of mapping methods. And all of the materials that have been generated through these visual processes have been used as platforms for engagement to support two-way communication and promote a more balanced interaction between community members, research teams, and also representatives of government. And in this slide, you can see an image that was captured in a health science engagement project that we led in 2016 called The Heart of the Matter, where residents of a township in Delft, where there's a very high levels of heart disease, took part in a photo voice process, and they used their photographs to engage with a team of cardiovascular disease researchers from Stellenbosch University. And the topic was on food choices and diet. Now, because participatory visual methods drive the creative expression of lived experience, as we've very well seen through Ian's presentation, they can also heighten vulnerability. So, for example, in the Heart of the Matter project, when the researchers and community participants from Delft met each other for the very first time, we wanted to build a rapport between them. And we thought that it would be a good idea to have everybody in the room taking part in the same activity at the same time. And so to make this happen, they were all asked to create food maps to illustrate their typical weekly food choices. And in this slide, you can see a youth participant in the Heart of the Matter project presenting her food map to the wider group. Now, inadvertently, it turned out that what was intended as a bonding activity caused a degree of discomfort amongst some of the community members and the scientists because of the disparity in the types of food choices that they were showing on their maps. So a main point of learning that came out of the Heart of the Matter project in relation to working with visual methods was to focus on topics that help to level the ground and dilute the power dynamics between researchers and community members, especially when they are first introduced to each other in a research engagement activity. And a subsequent science engagement project that we ran in 2018 called Bucketloads of Health, the visual method of hand mapping proved to be quite effective in this regard. So in the Bucketloads of Health project, we partnered with a team of microbiologists at the Water Resource Lab at Stellenbosch University, and they were undertaking research on water quality in an informal settlement called Enkanini on the outskirts of Stellenbosch. And through the project, we facilitated engagement between the microbiologists and a group of concerned people who were living in Enkanini. And the hand mapping method and the way the researchers used it to introduce themselves to the community participants in this project is described in a paper that was recently published in Frontiers in Public Health. And I think Helen is maybe going to share the link to that at some point in the chat. But by creating the hand maps and presenting them to community members, the scientists were able to make themselves more approachable, because they talked about their family members who had influenced them and strongly conveyed their aspiration to make a difference in the world, and especially to improve the quality of life of people living in informal settlements. And so this approach allowed the scientists to talk about their passion for their work in a down-to-earth way, and this had a really strong influence on the way that they were perceived by the Enkanini residents. Now, a further challenge that can come with using participatory visual methods is the number of participants that can be included in the process. And some of these methods require substantive one-on-one interaction between engagement facilitators and participants. And this can necessitate fairly small group sizes, such as 10 to 15 people. And this slide shows a body mapping activity with residents of Enkanini as part of the Bucketloads of Health project, where each participant made a body map, and these body maps were used as exhibits for engagement on the topic of water quality with the microbiology team. Now, whereas body mapping can be a really effective method to understand the embodied experience of a health research topic, it does require a lot of room for group work. And the activity shown in this image was facilitated in a spacious church hall in the town of Stellenbosch. In addition to group size and the size of the venue, there are a number of other important considerations that need to be made when working with visual methods. And these will vary in significance depending on the type of method being used. So for example, you also need to think about how much time the method that you want to do is going to take. Does it need any special equipment or accessories? Is there a training component required? Is there any technical expertise that you need to bring in that you don't already have in your team? How much is it going to actually cost? Working with visual methods isn't a cheap way of doing engagement or research. And also the really important point that I want to emphasize is making sure that you budget for stipends to compensate people who do take part in visual method activities, because it really can take up days, weeks, or months of their time, and of course their time is valuable. So as I've just mentioned, the number of community participants that can be included in an in-depth visual methods process can present a challenge when you're trying to understand a wide range of experiences and perspectives. So for example, this slide shows an aerial photograph of a small section in the township of Delft. And this is a township with a population of at least 120,000 people, where SLF's been undertaking community engagement and action research for over a decade. And to identify Delft community members to come on board as project participants, we tend to begin by reaching out to people who we know that live in the township. So this means approaching community-based organisations, community leaders, community advisory boards, and people that we've worked with on previous projects to support us in identifying new project participants. And a central criteria is that people who are identified as potential participants are concerned about the research topic. In other words, the challenge that's being investigated in some way is affecting their life, and they're interested to engage with it or to be involved in action and to do something about it. And having a sustained presence in the places where we've worked in Cape Town has really allowed us to grow and strengthen the network of residents that we can include in our engagement in a very large community such as Delft. So earlier on, I mentioned the concept of inclusion in research engagement, and that working with PBMs can place a limit on the number of people that can be directly involved in a creative engagement process. But it's important to also remember that inclusion in research engagement can be extended through the sharing of the visual materials by the people that created them with multiple audiences. So over the past 3 years, and since 2019, SLF's been leading the fieldwork for an action research project called Water and Fire, enhancing capacity and reducing risk through 15 best bets for transformative adaptation with vulnerable residents on the Cape Flats. And the main thematic themes of the Water and Fire project are environmental disaster risk management and resilience. And the overarching aim of the action research has been to generate a series of community-driven potential interventions to counteract the impacts of flooding, fire, and water shortage in highly marginalized settings, such as informal settlements. And these are environmental hazards that are projected, of course, to become more frequent as climate change advances. So in the Water and Fire project, we've been working with a group of 30 co-researchers closely over the past 2 years who come from 3 marginalized areas of Cape Town that are particularly badly affected by the 3 environmental hazards that we've been exploring. And we've supported them through a layered and iterative participatory visual methods process. And the best bets, or these interventions with potential, have been generated through the creation of digital stories, community maps, and photographs. And the visual materials were then analysed by the community participants who made collective decisions about priorities with regards to what could and should be done and by whom. The Water and Fire project has a core intention of policy engagement. So in thinking about impact, I'll just focus on one specific aspect of the project, which has been stakeholder engagement events that have been held in the 3 participating communities within the past 6 months. So they were held in April, May, and June this year. And this slide shows one of the engagement events, which was led by the project participants from Sweet Home Farm, which is an informal settlement severely affected by flooding, and one of the 3 participating communities in the Water and Fire project. And the event was attended by over 40 Sweet Home Farm residents, as well as researchers from various academic institutions and multiple representatives of local government. And during the event, the project participants who'd taken part in the visual methods processes shared their digital stories, their community maps, and their photographs with the audience to illustrate their experiences of flooding and express their perspectives on actions that could be taken to mitigate the impact of flooding in their community. And in unpacking these best bets, the project participants expressed that some of the responsibility for acting on the intervention strategies lies within the community at individual, household, and neighbourhood level. Some responsibility lies with government, especially around the need to improve infrastructure and upgrades such as drainage infrastructure. And it was also recognised that there's a need for community members and local government to be working together in partnership to achieve some of the potential interventions that were being put forward by the community members. And at this event, there was a really lively discussion amongst the audience about the research topic, and a lot of debate about the priority interventions to counteract flooding in the informal settlement of Sweet Home Farm and other similar settings. And I just wanted to share with you some of the responses from the people that attended the event that were from government. So Odwa Ndesi, who's a community liaison officer in the mayoral committee in the city of Cape Town, said, "Here today I heard testimonies of lived experience. What it means to go one day without water. What does it mean for a chronically ill grandmother who needs to take medication? That's life-threatening. To hear that, it shifts the narrative. You start seeing that provision of water is indeed a human right to life." And Shanaz Kasim Musa, who's a resilience analyst at the City of Cape Town, who attended all 3 events, said, "There's such a lot of energy at these sessions and a group of people who want to positively affect society. And I think that's amazing. And it's also given me a sense of hope." Tokozani Norushi, who's the Deputy Director of Policy and Research for the Western Cape Government, said, "I think with greater participation in meetings with the city or local government, in calling for ministers and other powerful politicians to sit with them, I think you'll find that people become more confident in the way they engage with powerful structures." And Yusuf Mohammed, who's a transversal civil engineer in the Department of Water and Sanitation in the city of Cape Town, said, "What I've experienced here is enlightening. Listening to the whole video that the women presented through pictures, it's giving us real data on the ground. We want to do more, but I think it's just for the community to understand the city's challenges so that there can be a constructive dialogue between us." And then Worship, who works on public awareness and education for the city of Cape Town, said, "What has been done in this community is incredible. I would love to be part of it as far as I can so that we can action these plans that these community members have put together and we are in par with what they have said." And on the 28th of this month, next week, Wednesday, we're going to be holding a co-production towards our urban resilience in Daba, where we're going to bring all of the community participants back together from 3 settings and bring them into conversation with, we have multiple people from the city of Cape Town and other academic institutions who are coming, and we're really going to breakaway sessions and interrogate those best bets and find out what actually can be done and have some commitments put on the table by the people in the room, whilst also trying to understand the real challenges within governmental structures that put obstacles in the way of making a difference in these kind of settings. So a lot of the points that I've touched on today are also available through a handbook that I wrote together with Mary in 2019, The Practice and Ethics of Participatory Visual Methods for Community Engagement in Public Health and Health Science. And this is available on the Global Health Network. And I believe that Helen is also going to share the link to that today. Thanks very much, Helen. And that also has suggested readings from other practitioners and scholars in the field that have got some really excellent tips as well through the publications that they have published themselves. So I'm going to finish there, and I would just like to acknowledge all of the community members from Delft, Enkanini, Overcome Heights and Sweet Home Farm, and all of the researchers who've taken part in our health science engagement projects. The Heart of the Matter and Bucket Loads of Health were funded by Wellcome, and the Water and Fire project is funded by the UKRIGCRF, or UK Research Innovation Grand Challenges Research Fund, and we're co-leading this project with a team of investigators from the University of Stirling in Scotland, and of course my colleagues at the Sustainable Livelihoods Foundation. Thanks. I'm looking forward to any questions in the Q&A session.
Thank you very much, Jill. That was really enlightening and amazing to see how people have been using, or how you've been using these methods to really give a platform for community members to speak about their needs and their perspectives on priorities in these very important areas. So thank you, Jill. So our next speaker, Dinesh Deokota, he has pre-recorded his input because he's currently in a remote part of Nepal making a film about leprosy. Dinesh is an award-winning documentary filmmaker with a focus on highlighting human rights and social issues. Dinesh was the most experienced filmmaker on our SPEAR team, and so supported the teams in Indonesia and Vietnam to develop their projects. And he was on hand to help them problem shoot. He also led the project in Nepal, working with over 20 community participants to help them recount their experiences of living through the pandemic. So he describes that process here. So I'll just ask Adam to play Dinesh's recording. Thank you, Adam.
Everybody. I'm sorry I could not be with you here today, but considering that this launch is such a significant moment of the digital diaries process, I cannot but take time off to record and speak of my experiences of dealing with the project here, which I coordinated in Nepal. I'll start my talk by saying that it was quite a challenge to pull it off. You remember that the time it was undertaken in, it was one of the strangest times that we've all been through. There was a lockdown on, the mood was somber, there was all prevailing fear of the COVID virus. And there was this general sentiment of uncertainty and insecurity. With this background, our job was to convince ordinary Nepali people, all of whom we'd never met or known before, to participate in this digital storytelling exercise. They were required to film their own stories and somehow regularly deliver the raw footage to us for editing, even though some had no access to the internet or any form of free movement for that fact. I'll remind you here again that the country was in near complete lockdown with limitations on movement, and the rising COVID cases and rising deaths due to the virus dominating the headlines and sort of distressing people's minds. Also in Nepal, we have a share of geographical challenges. We have high mountain areas, hard to access mid-hills, and the southern plains, which can be blazing and uncomfortably hot during the summer months. As it happened, most of the digital diary activities here took place during the hot summer months when the monsoons were in full swing. Access to the participants was already a challenge with the lockdown, but was exacerbated further when landslides washed roads away and floods made traveling for our local contacts near impossible. Of course, it was easier for me to conduct stories that were taking place in Kathmandu, as I'm based here. But for stories in many of the outlying districts and villages, I mean, for those stories, I might have been living on the moon, so to say. So some of our contributors had access to basic cameras like a smartphone, but there are who did not possess such a device. In such cases, they were expected to take help of a friend or a family from whom they could borrow a device, or maybe have them film on their behalf. So as I said earlier, some who did not have access to the internet, it was a difficult task indeed to stay connected with them for updates and also to keep them motivated to continue with filming of the stories. But considering that none of them had any previous experience of storytelling, I mean, that too using film as a medium, I did have lingering doubts in the beginning as to whether we could pull it off. But pull it off, we did indeed. By the end of it all, we had about 20 participants. Some fell by the wayside, having lost interest, but we did end up with 10 stories that I feel are quite powerful and deserving of any screening platforms. We've taken the films back to the communities where they were made and held like large open area screenings under the heading of Lockdown Lives. So during these screenings, many in the audiences shared their experiences of the pandemic and the lockdown. We found that a key theme that ran through all the digital diary films from Nepal was that of mental health. And this was reflected during the discussions with the communities. Many indeed saw their own experiences being reflected in the films, and we did deal with quite a few emotional recollections of their lives during the lockdown. Besides, the films have also been screened at a respected film festival here in Kathmandu, and I must say that they were received very positively, and the reactions to the films were similar to the ones we had in the community. I think it did leave people with a great deal to reflect upon once they left the hall after the screenings were over. The stories that we got were quite varied. A patient on dialysis who needed 2 dialysis sessions, but followed on hard times due to the lockdown, challenges for caregivers, students' woes, the plight of daily wage earners, a large family living in close confines, a story of a medical worker who faced abuse because she was one of the earlier ones to contract the coronavirus, a father's plight to get himself and his daughter fed, and many other stories. One that really stands out for me is of a young father out of work with children to feed. So they all sort of reflected the climate of uncertainty back then, back when the times were strange. So it all worked out in the end, but getting it done was something else. The foremost was to find these contributors, and the second to convince them to participate. And again, let's not forget the stifling lockdown dominating all lives in the background. So how do we convince people to share their experiences of the COVID situation and also film themselves in the process when we cannot even meet them? How do we even convince them that our objectives are benign and that this activity will not bring any embarrassment or harm to them when they've never even met us, or they may even never meet us in the future? Our starting point were the networks of connections that we had worked with or built in the past. So these are organizations, individuals who work directly with the communities and are trusted by them, and equally important, trusted by us also. Some of them were locally based NGOs, some were mothers groups at particular villages, some were youth clubs, and a few were local reporters, journalist associations. So within some of these organizations, especially the NGOs, there are someone special. They're called social mobilizers. So social mobilizers' work is to sort of work indirectly, directly with the communities at the ground or literally at the grassroots levels. There are people who go from house to house. There are people from within the community. They are the unsung heroes who ensure the success of any project interventions in the area. But most of all, they are a familiar face. And we were in great need of such faces at that time. So the social mobilizers bridged that gap for us. They were the trusted faces for the would-be participants. They would go to the participants and sort of they were like our go-between. It is difficult from a distance to try and convince people we've never met to participate or to convince them to find others to do the same. The social mobilizers, they simplified the process by helping us identify potential participants and also to introduce us to them and to explain our objectives for the process in person in their front yard, which made a difference. Also, just like social mobilizers, we had local journalists who are also familiar with the communities. We were in touch with one or two of them, and they were of invaluable help in finding people who were willing to contribute their stories. So, I mean, it's hard to explain film and storytelling to someone without any experience, but a journalist, grasp it quicker as stories are a part of their career. So we were lucky in a sense that one journalist, she happens to be the only female journalist in the district, and she had her own story to tell, and she too became one of her contributors. So she was able to use herself as an example to other contributors and could easily explain to them how she did her own filming and how she covered things. Also, the journalists had mobility and permission from the authorities to move around to report. So we were able to do a lot of findings, fact findings, and follow-up work with their help. So we also used ambulances or ambulance drivers. So just like journalists, ambulance or the drivers, also have permission to move about because of the nature of their work. So ambulances here in Nepal, I mean, to give you a context, ferry people in need of medical care, whether it is an emergency or not. It is quite unlike the ambulance service you are familiar with. I mean, in many cases, in Nepal, people hire ambulances as it is a convenient way to transport a sick person to a hospital, as a sick person is able to travel lying down comfortably during the long drive to the hospital. So it's true that during this lockdown, when all short and long haul transportations had been suspended, including flights, some people were getting around the rules by making their journeys in hired ambulances. So we also had to give this form of movement a deep and hard look and decided that it worked for us too. But having said that, ambulances here do deal with emergency cases also. Sorry. So we relied on some locally based ambulance drivers as our messengers when they happened to be in the area. They also happened to manage exchanges. We relied on some of them, not just to deliver messages and instructions, but also to help us gather some of the footages from the contributors, sort of by exchanging memory cards with the footage in them. So in a way, they served as our couriers. In addition, we were also able to work over Viber and WhatsApp, where connectivity was good. The fact that in fact, the most seamless form of connection and gathering, it was the most seamless form of connecting and gathering material for us. They are instantaneous and we were able to review the materials as soon as we received them. And the best thing was that we could build a connection with the contributors more effectively, because as we began to share our photos with them, they could see who we were, what we looked like, we could understand each other, and this understanding built a connection which led to trust. So personal networks were also of great help in such circumstances. For stories or contributors from in and around Kathmandu, that is where I'm located, based, suggestions from friends, colleagues were very helpful. We found some incredibly powerful stories, and as a result, it's there online on the exhibition for you all to see. A big challenge for us at the time was to keep the contributors motivated and for them to be inclined to carry on with the filming. We asked them to share as much of their lives as possible, but sometimes it can be understandably tiresome and tedious, especially when not having a very clear idea as to the documentation process involved. Also, the miserable economic situation caused in their lives by the lockdown did not help. Some did give up on the process, but we had anticipated that given the lack of person-to-person contact and the difficulty of explaining the process over a phone or by a third person, it was bound to happen. We did call them regularly with words of encouragement, but sometimes things don't work out, as with life. We did provide financial compensation for their time and effort, but also to keep them motivated. It was a token amount, but I do believe it was of help to some people that participated, especially for those that were having a really hard time then. We are grateful to them for their participation, in spite of all that was going on in their lives. But I also do believe that for some participants, the process was somewhat cathartic. It was quite a stifling atmosphere during the lockdown and living in close quarters with the threat of COVID hanging over their heads. It did create its own unique set of circumstances. One story from the Southern Plains typically exemplifies this. In it, Lakshmi, a young woman living with 13, 14, 15 family members in one house, would recount and record her experiences from time to time, mostly at the end of the day. So she mentioned to me later on that this was kind of a release for her and that she was better able to deal with the cramped sort of physical, mental conditions in the house with the help of this exercise. Her experience of the lockdown was an existence that was filled with arguments and bickerings with her large but confined family, but a quiet recording session, expressing her thoughts and feelings on a mobile phone would do sort of wonders for her mental health. But more than anything, I think the digital diaries have become a kind of visual documentation of our society in Nepal during the lockdowns. I mean, we did hear so much then of the sufferings during at that time on the news, etc. But most of them were general reporting. Through the simple storytelling methods, we have a glimpse of their personal lives. We've gone into their homes, we've met their families, we've seen how their lives have played out. We've seen their stories through our own eyes. And I'm really grateful to the participants for sharing their lives in such candid and open manner and giving the world an understanding of their existence at this time. This entire experience for me has been, in a way, a humbling one. And I'm proud of the films that have come out as a result. And I know that some of the participants feel the same also. So as I said in the beginning, it was quite a challenge. And I did have my doubts as to whether we could get it done, given the circumstances. Sorry. But it did happen. And I hope you'll take some time out to see some of the lives that played out during the COVID lockdown in Nepal. I mean, it gave me great satisfaction indeed when semi-normalcy returned, once the lockdowns were lifted, and I got to meet some of the participants in person. Like I said, the effort has played out very well, and I would like to dedicate the stories from Nepal to this young father featured in one of the stories, who unfortunately took his own life shortly after his story was filmed due to mental trauma and the financial uncertainties that hit him all of a sudden because of the lockdown. So I hope you will take a time out and visit some of the stories on the Digital Diary virtual exhibition. Thank you so much. Thank you very much for your time. Thank you indeed.
Thank you, Alex, for showing that very interesting and powerful reflection from Dinesh about his experience of working with the participants during that very strict period of lockdown in Nepal. So we have some time now for some discussion and questions. If anybody has questions, please put them in the Q&A function on your toolbar, and we'll try and pass those over to the panelists. So please do put more questions in there. So there's a question here. I can see to Ian and Dinesh. Unfortunately, Dinesh isn't on the call at the moment, but perhaps Ian, from your experience, what was the motivation for participants to spend this time to create their story?
Yeah, thank you, Mary, and thank you for such a great question. Actually, a few months ago when we conducted the virtual screening with some of our participants in Vietnam, and we did ask this question to the participant, and one of the reasons that the participants was that they really hope that spread out to other people around, like the countries, or even other countries, when they with the hope that the story can make people believe that this is the real issues in society, and the pandemic is happening and it's killing the people around their village. It's not fake news or any it's a real thing that everyone should believe, and that with the hope that the pandemic can end soon, so then can go back to work and their children can go back to school. Very simple hope, but I know that there's a comment with from a friend in our chat say that even though right now there's a lot of people don't believe in COVID pandemic isn't a thing at the moment. Yeah, and it's in different context. I think I can just be able to speak for Vietnam context, that is from our participant experience, that's their motivation to join the project.
And I think Dinesh referred to it, that some of his participants, or some of the participants he was working with, mentioned that it was quite cathartic being able to talk about their experience, and they just felt that they were being listened to. I think especially perhaps in Indonesia, where in the rural areas, people were working as a group. I think they felt that it actually built a sense of community, because the groups, they came together with a group of young people or a group in a church, and they made their stories together, and it really gave them a focus to work together during that period. So there's another question here, which Ian, could you answer this? And then maybe Jill as well. What was the most challenging aspects of conducting the participatory projects that you've done?
Yeah, thank you, Mary. I think from my perspective, regarding to the conducting the digital diary in Vietnam, the most challenging thing is to empower the confidence of the participant, because it's a lot of things related to sharing your own like personal stories, which is not a culture that Vietnamese people feel comfortable or confident to do so, and a lot of participants in the project told me that they don't think that their story matters. It's why they don't see the importance of sharing their story, because no one gonna listen. So that is very challenging for me to like convince or like influence on them to like to see that, to let them know that their story matters, and they should share, and also like empower their confidence throughout the project to like use their phone to take picture of their daily life to like tell their own story. Yeah, but that's just like one of the challenges that I personally felt during our project.
Yeah, thank you, Ian. Jill,
Yeah, thanks, Yang.
Share your perspective.
Yeah, sure. So in response to the question about the biggest challenge, I think with this kind of work, it's because we're dealing with issues of people's real vulnerabilities, health and life vulnerabilities, as well as managing the kind of technical aspects of getting a digital story produced or a set of photographs printed, for example. You also need to have to read the room. So you need to be able to have a sense of what's going on within the participant group, within, you know, certain individuals may be struggling on a certain day. So it's just being conscious of what's going on in their lives, obviously without being kind of invasive about that, because people's lives are very precarious when they're living in these informal settlements, and they're dealing with a lot. So it's really just about balancing out the need to get you know, these products made, against the fact that you're dealing with really vulnerable issues and really people whose lives are hard and who are living in these very precarious circumstances. And so just that constant kind of balancing act that you have to make. Yeah, and I also wanted to pick up on Jens' point about the confidence building, and when I presented on the Water and Fire project, and I was talking about those stakeholder events that we have just run within the past 6 months in the three settings for the research. We had an extra phase in the project which involved providing a lot of mentoring for to enable and to encourage and support the community participants to get up on stage and really lead those events on the day, because many of them aren't practiced speakers. They've never done anything like this in their lives before, and suddenly they're faced with a room full of not only their community, the other people that live in their communities where they live, but also all these people from local government, all these researchers from different academic institutions, and they've got to kind of now stand up there and take the stage and present their stories and talk about their best bets, and that is a big ask. So there's a whole process that leads up to being able to have them take ownership of those events on the day. And so through the Water and Fire project, we've really done a lot of learning about what that takes. But when it happens, it's absolutely magical.
Thank you, Jill. Can I just follow up on that point that you're making about asking the participants to present to, say, policymakers or people from the city, and what do you think is the benefit of having them present compared to, say, having a professional filmmaker come in and make a documentary of the needs, and compared to, so people who are not used to presenting and their films may not be particularly sort of polished.
Yeah.
Do you think that's still an effective way of affecting policymakers?
I think it's the personalness of it. So if I was to go up and present a story from one of the participants, say, to some people from government in a roundtable session or something, it just doesn't have the same effect as the person whose story it is actually standing up there and saying, this is my story, I made the story, this is what happened to me. It's just a fundamentally different kind of way of interacting, and of people really seeing how people are affected by these issues and what they think needs to be done about it, on the understanding, of course, that of course people have to be given the option, and if they don't want to do it, they don't do it. So there's a whole democratic process around, first of all, which of the visual, because you end up, of course, with hundreds of photographs and many stories and many maps, and it's, well, which ones get shown and who is going to actually present them and talk about them. And so that's a whole democratic process around choosing which stories and why, and what point are they making, or which photographs and why and what point are they making, and who's going to actually present them. And then what are they actually going to say? And there's time taken into kind of, well, what is going to be said? What is the message that's going to be delivered? And that's all part of the workshopping process that is kind of added on to, what's just getting the product made. Yeah, I think that obviously people need to be given the choice. If they don't want to do it, then you don't do it. But generally, we find that people are, in the communities that we worked on the Water and Fire project, were really, really excited and pleased by the opportunity to be able to, because they had such ownership, they've put so much work and so much effort into creating these visual materials. And now they're actually getting to kind of showcase them. So there's a lot of enthusiasm about taking on that role and leading those events. So yeah, that answers your question.
Thank you, Jill. And there's another question here that's come in from one of the panelists, which was around the longer term benefits. So once the project's finished, do you think, or do you have any evidence that your participants or the participants have built up any skills, or have they been empowered to change their lives in some way, or is the benefit just for that period of the project itself? So maybe Jill first, and then Ian, if you've got anything to add to that. Thank you.
Well, I sat with some of the project participants this morning, and we actually have many of the participants here today, and they're getting ready for next week's big event on the 28th. And I asked them these exact questions, and I got some really interesting answers. So there's a lot around communication skills. There's a lot around public speaking. And being able to, if, for example, they're in another kind of community group, another community organization, which many of them are, you know, they feel that their ability to then participate in those kind of gatherings has been enhanced. And also that some of so there's the learning that comes from actually engaging in a topic like water shortage, or engaging in a topic like fire. There's a lot of learning that just comes through awareness raising, knowledge around actions that can be taken to mitigate these these hazards. So there's that learning that happens, which is a kind of like individual learning, which they then say that they kind of communicate to other members of their family or other people in their neighborhood. And also one of the participants this morning said to me that she, some of the methods like the photo voice method has been taken into one of the local schools in Delft, where the life orientation teacher has actually started using a kind of photo voice type process with some of the learners in the school, in the secondary school, around issues that are really relevant in their life. So they'll go and take photographs and bring them back into the classroom and kind of discuss the photographs around a certain issue. So I think there are quite a few different kind of offshoots of taking part in these kind of activities. Thanks.
Yeah, thanks, Jill. I just wanted to add a little bit more about like the participant picking up these learning from our project during the process to just apply on their own personal needs. For like you say, in your case, it's like going back to the school to teach other teachers, but for in Vietnam, a lot of participants that we still been in touch with, because during the process we use social media platform as a main communication channel. So now I can see that I've seen the participate in the digital diary project, the participant from our project like be more confident posting their own story every daily life, like on their through a post, and they share their final production on their community through their social media platform as well, which is, I think that's very rewarding to see. And some of the participants even take it to a further use for the digital diaries. A digital skill that they learn from the project is that to make their own short videos about their poet school applications and like so on. So like I think it's that's very nice to see that the participant even after the project can still use digital skill for their own benefit.
Yeah, thank you very much for those reflections. So before we close the session, I want to introduce our final speaker to give some reflections on the wider integration of engagement with research. So Professor Guy Thwaites is the director of the Oxford University Clinical Research Unit in Vietnam, Indonesia, and Nepal. And the vision of OCRU is to have local and regional impact. Guy has been a very strong champion for integrated and well-funded community engagement program in all the OCRU sites, and supports engagement in the lab sciences, in community-based research, and in clinical research. So I'm very grateful for Guy to give time to close this webinar with his reflections on the impact and challenges of global health research and how community engagement can support those aims. So Guy, over to you, please.
Thanks very much, Mary. It's a pleasure to be here. What I'm going to to do over just the next few minutes is just take the perspective of a researcher, that's me, and a researcher within OCRU, a particular type of research program, and really tell you why I think doing community and public engagement is essential to the work that we do and essential to more generally all types of research. And next slide, please. So just a very quick summary of what OCRU is. Some of you will know this very well, but I thought there might be some of you who don't. So we're about 500 people working across 4 units in Asia. You can see the units down there in the left-hand diagram. So there's OCRU Nepal, you've heard a lot of today, OCRU Hanoi, OCRU Ho Chi Minh City, and OCRU Indonesia. And you can see on the right there that we have some main units, but we are a collection of very many collaborators and very many sites in which we work with. And our vision is to have local, regional, and global impact on health by leading a locally driven research program on infectious diseases. And I've underlined locally there because that probably is the most important part of that vision. Next slide, please. And just to give you some sense of what we do and how we do it and where engagement fits, we grew up 30 years ago basically doing hospital-based clinical research and clinical trials, and that remains very important to what we do. But over the years, we've added to that. We've added laboratory research, which helps us understand things like mechanisms of disease and mechanisms of therapeutics, and also become increasingly interested with what happens in the community. Obviously, most infectious disease transmission occurs within communities rather than hospitals, but also we recognize that we have to be able to understand what communities feel about infectious diseases and what they feel about research and able to do in order to do the best and most impactful type of research. So public engagement sits there within the community, although actually it crosses all of those domains really and remains and is essential to all of the aspects of our research endeavor. And generally though, and through public engagement as well, we want to be flexible in what we do, respond to the most important priorities of the communities and the hospitals, responsive, integrated, and influential. And the outer part, if you like, which is policy engagement and global health and impact, if you like, is one of the areas in which we have impact, but not the only area. Next slide, please. And so just to give you a very high overview of how engagement strengthens our clinical research. So on the outside, you've got, at the top, you've got patient and carers' voices, and at the bottom, you've got dialogues. And both of those provide researchers, I think, particularly with very important context. It's very easy for researchers to become rather too obsessed with the biomedical question, be it in the laboratory or on the wards, and to forget about the actual people that are being researched and the effect that diseases have upon them. And then in the middle are the bits that actually help researchers do those researchers, and particularly clinical trials, for example. So the generation of questionnaires, consent forms, and so on, that are essential to good research. And then recruitment, another source of great anxiety, often for researchers, but engagement allows effective, fair, and ethical recruitment into trials, which again is essential. And then last of all, dissemination and making the findings of the research understandable to those communities, particularly in whom the research was conducted. Next slide, please. And there's been a number of ways in which we can show examples of how effective research engagement is. And you've heard a lot about them today, and I won't linger on this slide because you've heard a lot of this today about how in OCRU and elsewhere, how important engagement was within the context of the COVID pandemic. Next slide, please. Engaging with hospitals in patients, as I've said, the hospital-based research is a very important part of what we do, and therefore the engagement within hospitals is important to be able to develop trust, particularly. So trust between the hospital staff and the researchers and the patients using the hospital. And all of these different examples, which I show you here, and I won't go into details, just examples of how Mary and her team have been able to build trust and within the hospitals in which we work. Next slide, please. The community advisory groups are well used by many people, and we've started to use these really only in the last 5 years. And you can see the various different types of them there. There's a generic one, which is relatively recent, which I think is going to be incredibly useful for a lot of our research, which is the Health Research Advisory Board. And then ones which you can see there on Hep C, leprosy, and pediatric diseases, for example. And then lastly, youth advisory groups. And it's very well known and acknowledged by WHO and UNICEF, for example, that the engagement with youth and youth groups is very important for community engagement. So next slide, please. And then lastly, really engaging with patients in the community. A lot of our research projects are in the community rather than in research in hospitals. And again, for all of the reasons I've outlined, this is an important function of research and an important method of ensuring that the people in whom we research understand what we do and why we do it. Next slide, please. So in summary, I would say that public and community engagement is essential for our vision, and particularly our vision for locally relevant, ethical, efficient, and impactful research. And if we look, particularly from the OCRIS perspective, at the critical areas which we research, emerging infectious diseases, drug-resistant infections, clinical trials, climate change and health, engagement plays a central role in all of the research that we do for these areas. So that's it from me. Thank you very much. It's been fascinating to hear the session, and I suspect there may not be time for any questions, but if there are any, I'll be very happy to take them. And the last slide is from Mary, which unfortunately isn't in my deck because I wasn't able to share my deck. But Mary, I don't know whether you're able to share it.
Don't worry. There was just a slide of the acknowledgements. Yes, I just wanted to thank you very much, Guy, for your presentation and that perspective of why and how engagement can benefit research. So thank you to our audience for listening, for your participation, and another very big thank you to our speakers. So this session, along with all the other material, will be on the Connect and the web sites, and there'll be a link posted into the chat. So, and then, sorry, just finally, if you haven't signed up to Connect or Mesh, then please do so. And there is a short survey about your experience of health workers or field workers that we would like to gather some information to help us improve our Connect site. So there is a survey in the link as well. So just finally, just thank you very much for everybody who's participated in this webinar, and I hope that you will be able to go onto that exhibition and the virtual exhibition and see more of those films. So thank you again.